Thanks so much for joining us today, everybody. Again, in Regina at the Legislative Building, we have Premier Scott Moe and Minister of Finance Donna Harpauer. Joining us on the line is Dr. Saqib Shahab, Chief Medical Health Officer for the Saskatchewan Ministry of Health, and Scott Livingstone, CEO of the Saskatchewan Health Authority. Premier Moe will have an opening statement on today's COVID-19 case update, followed by a brief opening statement from Dr. Shahab. Premier Moe and Minister Harpauer will then speak to the province's revenue projections. Premier Moe?
Well, thank you and good afternoon, everyone. Our government is committed to doing everything necessary to protect Saskatchewan people from the spread of COVID-19. Of course, the economic restrictions that we have put in place are having a significant impact on our economy and on our provincial revenues. And although it is too soon to tell exactly how large that impact will be, our Ministry of Finance and our Minister of Finance have been looking at a number of different scenarios. And we want to share those scenarios with the people of Saskatchewan today. Financially, I must say that Saskatchewan is better positioned than just about any province in Canada to address this challenge. But the impact is still very significant, which should come no surprise to anyone when you consider how much the economy has slowed today, not just here in our province, but across our nation and around the world. So the Minister of Finance will go through these scenarios in just a couple of minutes. But before she does, I will quickly go through today's case numbers, and then I will have Dr. Shahab add a few comments. Well, today in Saskatchewan, it is another positive day. We have 2 new cases and 9 more recoveries. 12 days ago, on April the 5th, the number of active cases in Saskatchewan was 179. Up until that date, we had more new cases than recoveries every day. So the number of active cases was growing each day. In the past 12 days since then, we have had more recoveries than active cases in 11 of those days and an equal number on one day. That means the total number of active cases has been falling, and today is now down to just 75 active cases. This is very good news. And I should note that while our numbers are very low, we can probably still expect some localized outbreaks from time to time. And the important thing to acknowledge is that we have the capacity to perform the testing required, the contact tracing, and isolation to control these kinds of outbreaks quickly and to control them effectively. And our health system is poised and ready to respond. I also want to note that effective April the 28th, staff at our long-term care homes and our personal care homes will not be allowed to work at more than one facility. This should further reduce the risks to our seniors in our seniors' care facilities. What we are doing together, it is working. Together, we are reducing the spread. Together, we are flattening the curve. So for that, I say thank you, Saskatchewan. Dr. Shahab?
Thank you, Premier. So further to the Premier's update on the case numbers, I did want to emphasize that while our overall cases are low, we need to emphasize protecting the most vulnerable. That includes residents in long-term care facilities, personal care homes, and assisted living facilities. That is especially important because today we can unfortunately provide 2 updates that are of concern. The Regina Eden Care Assisted Living Facility that about 2 weeks ago had a staff member who was COVID positive now has a second staff member who's COVID positive and 3 residents with symptoms under investigation. So obviously these are high-risk situations and they are currently being managed with close oversight by public health. And secondly, we had a staff member who was reported positive in a long-term care facility in the north. We have just been informed early this afternoon that there are 3 additional cases. 2 are non-household contacts, and 1, unfortunately, is a resident of the long-term care facility. So we have an outbreak situation in the Losh, which again is being actively managed by the medical health officers and public health, along with the staff of the assisted living facility in the north. So these two examples really emphasize all the steps that are being taken today in terms of updating the public health order, which now includes and emphasizes through an order all the steps that the SHA has already been putting in place, which includes that staff restrict work to one facility and do not work in more than one facility. Staff have health screens before and after each shift. Staff use appropriate infection control practices, including where required masking at all times. And we hope that these additional measures will continue to minimize ongoing risk in not just these two impacted facilities, but all long-term care facilities, personal care homes, and assisted living facilities in Saskatchewan. Thank you.
Thank you very much, Dr. Shahab, not just for your report here today, but for everything that you have been doing over the last number of weeks. In the past few weeks, Dr. Shahab has literally become the very face of our healthcare system here in Saskatchewan, and so I want to take a moment just to recognize you for your efforts, Doctor. I also want to take a moment to recognize and thank the thousands of people that work within our healthcare system, the doctors and the nurses. Thank you to all of the other staff that work in our hospitals and in our long-term care facilities. In essence, thank you to everyone that works in the Saskatchewan Health Authority. Thank you to everyone that is working so very hard to respond to this crisis and to keep Saskatchewan people well. We appreciate it. I also want to mention the good work that our professional public service is doing in responding to this crisis. They are working very long hours under quite challenging conditions and tight time frames to support Saskatchewan people through this difficult time. Here's one example of the great work by the staff at the Ministry of Finance, the Ministry of Trade and Export Development, as well as the IT experts at the Central Services Division here in the public service. 1 week ago yesterday, our government announced the Saskatchewan Small Business Emergency Program. This was a brand new program, so the process to administer this particular program, it just simply did not exist. Staff in those ministries worked over Easter weekend to set up the application process for this program. The online application went live on Monday, and as of this morning, they have processed nearly 4,000 applications and they have paid out nearly 2,000 of those, with payments totaling over $2.5 million, and that's just in 1 week. So thank you to the staff that worked so hard to ensure the launch of this valuable program was able to occur and was able to occur so quickly. And once again, thank you to everyone in Saskatchewan for what you are doing to help out your friends, for what you are doing to help out your neighbors, and to help out our province. I'll now ask Minister of Finance, Donna Harpauer, to discuss the revenue impact scenarios that we have here in the province of Saskatchewan.
Thank you, Premier, and good afternoon. There's no doubt this is an unprecedented and challenging time in our province, our country, and the world. The COVID-19 pandemic is having a major impact on the economies and finances of every jurisdiction in our country and every country in the world. Saskatchewan's fiscal foundation is strong. We are well positioned as any province to meet this challenge. Still, the economic impact and the impact on the province's finances will be massive this year. While it is still too soon to know exactly how massive that impact will be, I thought it was important to release some different scenarios showing a range of how significant the impact might be depending on how long the economic restrictions remain in effect. On March 18th, a week after the global pandemic was declared and on the day our government declared a state of emergency, we released the 2020-21 spending estimates without revenue forecasts or a full summary budget. Forecasting revenue would have been impossible at that time, given the rapidly changing situation. We're now less than 3 weeks into a new fiscal year. It is unknown at this time how long restrictions will remain in place in Saskatchewan, Canada, and worldwide. It is still incredibly difficult to forecast revenue with any degree of certainty. The duration and severity of the current economic environment, along with consumer and business behavior after the crisis, will ultimately determine how large of a revenue decline we will face. On top of this, oil prices continue to come under pressure due to global supply and demand imbalances. We're putting forward a range of potential decreases in revenue in 2020-21 of about $1.3 billion, $2.2 billion, and $3.3 billion in relation to our 2019-20 mid-year forecast of $15.4 billion. We expect all revenue categories to see declines in 2020-21. The reason we've developed these three scenarios is because there is, as mentioned, still a lot of uncertainty. Our differing economic scenarios of real GDP of minus 4.1%, minus 6.3%, and minus 14.9% respectively come down to a number of factors. One being the length and the severity of the pandemic. Another, the duration and overall impact of social distancing measures. Third, the success of government fiscal and monetary policy around the world to support the global economy. Another is the length of time it takes oil prices to recover, and there is the potential changes in consumer and business behavior once the pandemic passes. This next slide demonstrates potential revenue impacts based on three possible scenarios. They are not forecasts at this point because we simply do not have enough data at this stage to do forecasts. We believe there will be significant impact to our tax revenues, our non-renewable resource revenues, the GBE net income, which is included in our summary financial budgets, and although to a lesser degree, we also believe there will be an impact on our own source revenues. At this time, we are managing spending within the amounts allocated in the budget estimates outlined on March 18th. Our government has committed to provide all financial resources necessary to address the COVID-19 pandemic, and this will likely result in spending increases beyond the amounts allocated in the 2020-21 finance estimates. Estimates will also be increased due to programs we have announced, such as the Saskatchewan Small Business Recovery Program and the Self-Isolation Support Program. There may be further spending increases dependent on federal relief decisions. Again, overall, our fiscal foundation and structure are solid. As the credit rating agencies have pointed out, our government has managed the province's finances well. We have maintained our liquidity. We have a net debt to GDP ratio that is among the lowest in the country, and will continue to invest in the priorities of Saskatchewan people. Saskatchewan was on track for a surplus in the 2019-20 and 2021 prior to COVID-19 pandemic and oil price collapse. The 2020-21 deficit is not a structural deficit. It is a pandemic deficit, and we will manage through it. We will develop a fiscal plan to bring our budget back to balance over time because we have the strength and the foundation here in Saskatchewan to do it. Thank you very much.
Thanks very much. We now have about half an hour for questions. We'll take the first question from the room. Arthur?
My first question is about these, I know there are forecasts, there are projections. I want to ask, a lot of these factors that we're talking about here are outside of the control of the government. It has to do with global markets, it has to do with what the federal government does. But how much responsibility do you think you should take for where we end up on that scale and how long it takes us to get back to balance? I mean, what is your government's role? What can you do? And to what extent should you be held accountable?
I'll take that one. Right now, very much most everything's out of our control. The responsibility we need to take is in the recovery, and we need to be very mindful of what that recovery will be and where we need to be. So that is why we made the decision in advance of the small business relief grant that we have come forward with. We want to ensure that there are jobs to come back to when this is over. And there'll be further decisions with that in mind of what does our recovery look like. We absolutely need to help our citizens manage through this downtime. But the federal government has, to their credit, come up with a number of programs to aid in that area. So our position is to see if there's any gaps and then to focus on the recovery so that when there is no longer wage support programs, let's ensure that we can have as many jobs for them to go to when we're done.
Follow up, Arthur?
Yeah, one for the Premier. So today, as you said, we're seeing more positive news in cases, but we do have this very troubling situation with care homes, and I'm also seeing that testing does not seem to have met your target for where you wanted to see it. Are you still staying on track with the potential for laying out the Reopen Saskatchewan plan next week? And what will be the likely time frame for actually reopening the economy? Not just laying down the plan, but reopening the economy.
Right. We will lay down not only the plan next week, but we will also lay down the first parameters of the time frame, if you will, the first a couple of phases, if you will, as we start to reopen our economy. Listen, as we go through the next number of weeks and months, we need to, until such time there's a vaccine, quite frankly, we need to understand that we cannot prevent everyone from contracting COVID-19. What we can do is slow the spread of this virus by proper physical distancing, by identifying where our high risk residents are in those long-term care homes, for example. And we strengthened some of the restrictions around long-term care homes this week and again today. So we will have COVID-19 cases here in the province as we move forward, and we will have local flare-ups, if you will, in certain areas of the province as we go through the next number of weeks and months. What we need to do is to manage those as best we can to ensure that we have the robust testing ability and capacity in place, of which we do. In fact, we have the capacity to not only go to 1,500 tests a day, but we have the capacity to go beyond that. We have tremendous capacity when it comes to contact tracing, with literally hundreds of people now that have been trained in the Saskatchewan Health Authority to track down or to do any of the contact tracing that is necessary when we identify a positive case. And then we have proper isolation plans that will be put in place to ensure that when these localized flare-ups do arrive, and they will in all corners of this province over the course of the next number of months, and I think we need to prepare ourselves for that. That we have the tools in place to identify them. We have the tools in place to ensure that we can provide the proper and appropriate health care, and we have worked very hard at this. We saw the modeling from the Saskatchewan Health Authority last week, and they are preparing for whatever might come at us from a healthcare perspective. So the resources are there. The resources with respect to having adequate testing, and we have had adequate testing here in the province. We're the second highest in the nation. The resources are there with respect to contact tracing. They're there with respect to the plan when we do identify these localized outbreaks, and they are there to ensure that we can deliver the health care for whatever we may need to provide.
We'll take our next question from the phone lines, operator.
We have Allison Bamford with Global.
Hi there. This question is for Premier Moe in regards to the federal funding announced for cleaning up orphan wells. In your release that was sent out this morning, you said you're not sure if this is either an initial step or an only step from the federal government. I'm just wondering, what more would you want to see done for the oil companies?
I would like to see a program put in place. I've said this many times. I'd like to see a program put in place similar to what was put in place for the auto industry about a decade ago. We have a serious liquidity issue in the oil and gas sector here in Saskatchewan and in other areas of the nation. And there are levers that the federal government can pull, and we're asking them to pull them. And we expect that they will in the days ahead. We're very appreciative of the program that was put forward here today. We do not have all of the details on that program as of yet, but if there is a provincial participation that is required, we will be looking at that very closely and working with our industry to ensure that this investment can be made in the very best interest of keeping Saskatchewan people working and keeping our very vibrant, and I would say one of the most sustainable energy industries in the world alive, healthy, and well.
Do you have a follow-up, Allison?
Yeah, this is for Minister Harpauer now. BC announced that it's going to be allowing some of its cities to run deficits this year because of the pandemic. I'm just wondering if this is something the province is looking into and why or why not.
We haven't looked into it to date. We haven't had those discussions. And I can't speak to our government relations minister. I know that she is on calls with the municipal leaders, if not almost daily for some time and probably reduced to weekly now. She hasn't brought that proposal forward. I know that there has been a request by them with concerns for borrowing, but there has been no formal request from our municipalities yet.
I would add to this, as we set the stage for an economic recovery here in this province, and we're hopeful that that can happen sooner rather than later, and I think the scenarios put forward here today speak to that. Part of that economic recovery will be through an investment in infrastructure here in the province of Saskatchewan, something that we're looking at very seriously. We have asked the federal government to accelerate and make much more flexible the federal infrastructure program so that provinces and potentially municipalities can capitalize on some of these much-needed infrastructure projects this year and next year, as opposed to 5 and 6 years down the way. So we are in those discussions, and we will be in active discussions with the municipalities to ensure that all of us will be able to afford that investment in the next number of months and years.
We'll take our next question from the room. Steph?
Yeah, this is for the Minister of Finance. Are you considering reining in public sector spending in terms of reduced work week, public sector wage cut, and or in light of the province's finances for 2021?
We are not considering any measures to change the expenditure estimates that we tabled on the 18th or tried to table on March 18th. So the agreements that we have with our public sector that are already in place and have been ratified, we will honor those agreements. We will probably review any going forward, of course, because our fiscal situation has dramatically changed. There has been no discussions of needing to reduce the public service at this point in time. But as you know, with each and every budget cycle, we review all of that, and we're going to have to be very mindful of our expenditures going forward, but presently, no.
Follow?
Yeah, this is for the Premier. Will you be introducing any travel restrictions for people heading to northern Saskatchewan, just given those communities there are more isolated, and now we have seen a bit of an outbreak situation in the Losh?
Right. So we have, I have been on the phone with Chief Cameron as well as some northern leaders. Our Minister of Government Relations has spoken to a number of northern leaders in First Nations communities and otherwise. And what that conversation continues. Where we have landed thus far, a number of those communities are in essence restricting travel in and out of their communities, and they have asked that they be allowed to do that. So we've been working closely with our northern communities on how to restrict travel and who should do it, and we're happy to have the conversation with them and happy to continue to have that conversation with them.
We'll take our next question from the phone line, operator.
We have Morgan Majeski with CBC.
Hi there. Thanks for the time today, folks. I'm just working on a story about the call line. And even though, roughly 719 calls have kind of come in reporting folks who are maybe ignoring some of the public health orders, only a very small handful of tickets have actually been issued. I guess for the Premier first and then Dr. Shahab, what is your response and I guess kind of gauge of the effectiveness of this line if we have only seen a handful of tickets kind of be distributed despite, hundreds of calls coming in?
Well, I'll make a couple of brief comments, and Dr. Shahab, if you have anything to add, but I would just say that it would be my hope that as the Public Safety Agency reaches out to these individuals, that they realize that they may have been not in compliance with the public health order and very quickly come into compliance. The public health orders that are out there are not out there to ticket and to fine Saskatchewan residents. It's to one, to educate, and one, to ensure that we are complying and reducing the spread of this disease and flattening of the curve. So the goal has never been about how many tickets we can issue. The goal has been about ensuring that people are complying with these public health orders. Dr. Shahab, do you have anything to add to that?
Yes, thank you. I think we need to understand that, while there's egregious, there's something that's very egregious that will be ticketed and fined to the full extent of the law, but at the end of the day, it is really up to each of us in terms of flattening the curve. And like the Premier said, we have, as a province, been leaders in doing that individually and collectively as individuals, families, households, neighbors, and communities. And I think that has to continue as we go ahead in the weeks and months. And even as some measures are relaxed, we still need to practice physical distancing. This is not going back to the old ways. This is doing work in the new normal, which will continue for quite a while. So from that sense, this is really something that we all have to proactively engage in. But of course, if there's egregious offenses, they are prosecuted and followed up as per the law. Thank you.
You have a follow-up, Morgan?
Yeah, just one. So, Dr. Shahab, speaking about the low number of tickets that have been issued, what's your kind of overall thoughts on the importance of this kind of 1855 number and the fact that we've seen so few tickets? What's your reaction to the fact that we've seen so few tickets and that people have been using the line?
So we can try to do an analysis of the summary of the calls that are coming in. Obviously, there's that number, and there's other ways through which people can express their concerns. So we can summarize what information is coming in and what action has been taken at a future opportunity. So thank you for that.
I would just say, Morgan, there has been additional work done as well by the Public Safety Agency, in addition to the phone calls that have come in on the line, where we have actually provided public safety officials or ESOs on the ground in communities, not to ticket people, but to work with the leadership in the community, in particular some northern communities, to ensure that people are being educated on proper social distancing and how we can continue to work together to flatten the curve here in the province.
We'll take our next question from the phone line, operator.
We have Murray Mandrick with the Leader Post.
It's Murray Mandrick from Leader Post. How is it responsible to not adjust expenditures and adjust them quite significantly? As Stephanie suggested, and you were proposing a 3.5% reduction 3 years ago, I guess, when the deficit was projected to be perhaps a third of what it is right now. Are you not thinking about layoffs? Are you not thinking about curtailing capital spending? If not this year, over the next? I don't understand how you can announce this much of a revenue drop and not suggest that there will have to be something down the road to make a serious adjustment to our finances, whether it's tax increases or otherwise.
Well, Mary, perhaps you didn't hear, I just said in year, this is not a consideration that we are, but with each and every budget cycle, this is part of the conversation with every budget cycle. But I want to just reinforce again that this is not a structural deficit. This is a COVID-19 deficit. It's a pandemic deficit. So therefore, the structure that we had in place, which is with the size of our existing public service, which is with the size of our existing expenditures in our line ministries, quite frankly, the revenues coming in was outpacing the expenses, and we were able to gain cash and come to a surplus position. So yes, it will take some time in order for the economy to fully recover, but when we get to a point where it's fully recovered, and if we're very mindful of our expenses and hold the line on any expansions and any increases, then those revenues again will surpass our expenses. It won't be done overnight, but I don't think it's helpful for Saskatchewan residents to just start cutting and slashing to try to bring it to a balance in 1 year. It's a significant deficit. It will take a couple of years to then get back to that balance that we need.
Follow up, Murray?
Yeah, if it's going to take a couple of years, you still have to offer something to suggest what direction you may be going in right now. It's obviously not going to happen overnight, but there's going to be debt servicing costs that are added. It's going to take a long time for oil and such to recover. Probably some of the spending extras that you're putting in right now is going to take a long time to adjust to. So I guess my question, once again, is over if not this year, over the course of the next couple budget cycles, what can taxpayers sort of expect? What can the civil service expect to sort of have to adjust to this? If you're being open and direct about how big the deficit's going to be this year, surely there is some idea, at least in broad strokes, in terms of what the public should expect in terms of less services or otherwise.
Murray, I long for the days where I just worry about a crop failure and a flood. And no, at this point in time, we are not having those discussions of the next budget. So we are only, 3 weeks into this budget? And you're asking me to foreshadow what's going to be in my next budget. So that those are not discussions we're having at this point in time.
I would just add to this, Murray, and just reiterate the minister's comments with respect to this. We are not in a position of having a structural deficit. We've made some very difficult decisions in the last number of years that have righted the structure of the Saskatchewan budget on the revenue side. What we are faced with here today is a pandemic deficit. For how long this goes on and what impact this has on our economy, and we portrayed 3 different scenarios here today. Nobody is quite certain at this point in time, but in the interest of being as transparent as possible with the people of Saskatchewan, we've presented these 3 scenarios today, and we will see what decisions are necessary as we go through the next number of weeks and months. As you can see, most of the pressures are economic pressures in our general economy and in communities right across this province, and those are showing up on the revenue side, where the real risk is with the Saskatchewan's state of the finances. On the expense side, we continue to operate within the expenses that we had tabled in the legislature on the last day that the legislature was open. Our expenses, our investments, if you will, have not been as large thus far as people may think. We have about $50 million estimated into the Small Business Emergency Grant Program. We have a few $1,000,000 that we have put into our post-secondary students. We have a few $1,000,000 that we have put into some of the regulatory streamlining some of the regulations in the energy industry and reduce the amount that the energy industry actually pays, as they pay for they're one of the few across Canada that pay for the actual cost of their regulations. So the risk is really the state of the economic health, this health of the economy here in Saskatchewan, and the impact that has on our provincial budget. So in the days ahead, what can the people of Saskatchewan expect? Yes, there will be some challenging decisions that will have to be made around a number of different expense-driven scenarios that the province has to make. But they can also expect that we will honor the investments that we had tabled in the legislature. We will honor the collective bargaining agreements that most certainly are in place. They can also expect that this is a government that is going to invest in the strength of the economy as we look ahead over the course of the next number of months and the next number of years, and it will take a few years to come out of this pandemic deficit situation. We're going to invest in infrastructure, $2.6 billion in our spending estimates that we tabled earlier. You can look for this government to likely increase that investment in the days and weeks ahead and in the couple of years ahead, most certainly. So the people of this province can look to a government that is going to, a provincial government, that is going to partner with the federal government where needed and dovetail in on their programs to support small business, to support large business, and to support industries that are creating wealth in our communities, and ultimately to support the hardworking people in community after community in the province of Saskatchewan.
We'll take our next question from the phone line, operator.
We have Adriana Christensen with CGME.
Hello, yes. My question for Minister Harpauer, and perhaps the Premier could answer, is when we first moved into deficit in 2016, you took big austerity measures, losing the SDC with more and then more PST, and that was just for a $1.2 billion deficit. This worst case scenario is 3 times that. So what would you tell people who don't know the difference of a pandemic budget, who might be hearing this and fearing the worst, that it will mean higher taxes and what it will mean for their businesses?
So the challenge we had in 2016 when there was a plummet in oil revenues, quite frankly, and it was sustained over a number of years, was that our expenses were greater than our revenues. And so that's why we had to take the drastic measures that we did, and we had to move away from our reliance on oil revenues. And we basically cut our reliance on oil revenues in half as a percentage of our budget. So that is what we mean when we say that the foundation of our budget is solid, in that now we're in a position where our revenues surpass our expenses. And our reliance on just oil is much lessened. So that's what makes this so different. When the economy recovers, and the Premier outlined a number of things that we can do as a province to help it recover, to stimulate the economy. When that economy has recovered, then we will be back in a position where our revenues surpass our expenses.
You have a follow-up, Adriana?
Yes, that didn't exactly answer the question about, I mean, you mentioned, yes, that there's less dependence on oil revenue, but would you look at raising taxes in the years to come to make up for the losses here, especially where while expenses may not be maybe within budgeting right now, like you said, you mentioned you have other programs and other financial support you're providing that may be accounted for at this point, but moving ahead, does this mean there could be higher taxes next year?
So what will happen this year in order to maintain the services that we provide is we're going to need to borrow. So it's not going to change our expenses per se. It means that our revenues are not going to cover our expenses this year because our revenues will be down. So we will need to borrow to do that. So what that will mean going forward is that we will have a higher interest, although we can borrow right now at very low interest rates, and depending how it's very challenging right now for the provinces to borrow. But when those markets become more accessible, we'll be borrowing at a very, very low cost. So what that adds to the expenses going forward is just whatever that interest rate is. Depending on the amount we could borrow, we could maybe retire some higher interest borrowing that we've had, and then that will soften the blow of interest rate increases. So it doesn't change, again, the expenses that we have, and when the revenues recover, the revenues will be there with an added interest cost.
I would just add to that the foundation of the Saskatchewan financial position is solid. We are well poised going into this pandemic deficit because of the decisions that we have made over the course of the last number of years. What we are seeing here are some fairly significant revenue changes due to COVID-19 and the restrictions that have been put in place in the Saskatchewan economy. But as we recover from this pandemic, economically recover from this pandemic, this government has faith that the economy in this province will rebuild, and we are going to make every effort to invest in the rebuilding and the recovery of that economy. We're going to invest in small business, as we already have, invest in the industries that are creating wealth in this province, and we're going to most importantly invest in the hardworking people that create wealth in each of our communities in the weeks, months, and years ahead.
We've got time for a few more questions. We'll take one from the floor. Steph?
Yeah, for the Premier, is this decline in revenue or the decline in revenue projections the reason why you're looking at lifting some restrictions on businesses to allow them to reopen?
No, the reason why we're looking at not lifting restrictions, but allowing additional businesses to open here in the province is so that we can start to have some people going back to work. We can start to stem some of the economic decline, if you will. What these are scenarios as to what this economic impact, this slowdown of economic impact will have on the government finances. What these three scenarios are is this government making every attempt to be as transparent as possible, as with the numbers that we have, to be as transparent as possible with the people of this province. The conversation around expanding the list of allowable businesses and services here to open in the province is a conversation that, yes, impacts the general economy of the province, but I would say the largest impact is to the general finances of family after family and community after community from corner to corner of Saskatchewan.
To the Finance Minister, we heard last month there's about $1.3 billion in cash that is available. You kind of characterize it as a contingency fund. What would it take for you to start to dip into that as we move throughout this year?
Payroll. Yeah, it will be our cash flow in order to pay our bills as we go forward. So we've been able to do some short-term borrowing, so that becomes cash coming in, as well as some revenues are coming in, because there's a lag in remittance of the various taxes that we collect. So we're still in around that $1.3 billion cash liquidity that we have available in our bank account. But as revenues, because as you know, we've deferred a number of our taxes, so we will need to be, watching the markets, borrowing where we can at the lowest possible interest rates, and we'll be drawing down on our cash just for payroll and other expenses going forward.
Go to our next question from the room, Arthur.
I just wanted to get a bit more details about the case at the new long-term care home that's just been talked about here. As I understood it, there was a staff member at a long-term care home who was in La Loche who passed it on to a resident. That's how I understood it. Just wanted to confirm that's correct. And then further, what is the size of that home? What kind of measures are being taken in order to contain the outbreak? If that could just be fully explained with whatever details you can provide, that would be appreciated.
Sure, Dr. Shahab.
So I'm sorry, could the question be repeated?
Oh, it was
Yep.
Go ahead, Jim.
Yeah, so it was in respect to the long-term care home, the one instance that has been confirmed in the community of La Loche. If there are any further details that can be shared, including the size of the care home facility, any other details about transmission of the cases.
So I do not have that detailed information at this point, but we can try to get that a full summary of the outbreak. There is a detailed outbreak report that was shared. In fact, I can just look at some. So there were about 10 residents who are being kept under monitoring, and one of those residents is positive, and then 10 other staff that are not close contacts who are being monitored. And at this point, that is the update, but we will get further details of the outbreak as they become available. Thank you.
Do you have a follow-up, Arthur?
So particularly on the higher end of these scenarios, this is looking like depression level stuff with this 15% contraction in the size of the economy, 27,000 jobs lost. We haven't seen anything like that in 90 years. And the last time that happened, I mean, the government was voted out of office. They didn't come back for decades. How do you survive something like this politically?
Go ahead.
I think the answer to that is we're hoping not to be there, right? But there is a recognition that this is a extremely unusual, never happened before type of scenario that we're in. And we're not going to be the only province there. As a nation, we're going to see this type of decline in each and every province. The difference that we're going to have in Saskatchewan is the strength we had going in. And I think we're going to see that more as we come out of it, in that we did go in with a liquidity position that was strong. So hopefully we don't have to do as much borrowing as other provinces. We're not in a scenario like, unfortunately, Newfoundland was, where they had to reach out to the national government because they didn't have the cash to make payroll in another month. So do we want to be here? No. But I feel, again, going back to the strength going in, and that was recognized with, Moody's credit rating, that we just recently had that report, who also recognized that our debt to GDP ratio, the liquidity level that we had, as well as the structure of our finances is strong, and that was from those difficult decisions that were referenced before.
I would just say what we are facing here, not just in Saskatchewan, not even just as Canadians, but as global citizens is absolutely unprecedented, in particularly unprecedented for our generation. What we are asking the people in our communities to do, virtually to stay at home as to stem and stop the spread of this disease, is the most that we have been asked for as a generation, for sure. It pales in comparison, as I've said earlier, to what previous generations have been asked to do in settling this nation, in fighting wars, literally, to ensure the freedom, the political freedom and the freedom that we have in our communities. But it is for certain the most that we have been asked to do as a generation. We're not facing this alone as the province of Saskatchewan. We are facing this as 10 provinces and 3 territories collectively as a nation. We are working together with weekly calls of the Council of Federation, what has been more recently weekly calls with all of the premiers and the Prime Minister. We are facing this with other nations as well, most certainly, and we are learning off one another, province to province, nation to nation. We are learning how to ensure that we are stopping the spread of the virus. We are learning from one another how best to provide healthcare services should we have a tremendous outbreak here in Saskatchewan, as we are talking with other provinces where they have far higher rates of infection. And we most certainly are collaborating on how best are we going to be able to recover not only our Saskatchewan economy, but our Canadian economy. And those talks are very active across this nation. And I appreciate the conversations that we are having with our provincial leaders, with the FPT table at the Minister of Finance, as well as Health, as well as a number of other ministries are talking virtually on a weekly or bi-weekly basis. So we are not facing this alone by any stretch. We are thankful, as we are well poised in this province going into this financially. We are well poised to have the opportunity to be able to invest in the recovery. We have, for all intents and purposes, have most of the restrictions that are already in place. We're going to adjust that as we try to open up portions of our economy in the weeks ahead. We have invested in the resources in our healthcare system to ensure that they have the resources to provide healthcare delivery in community corner to corner of this province, literally. And now we are starting to turn an eye to investing in the recovery of the economy here in the province of Saskatchewan, and that's what we'll see in the next number of months.
We'll go to our last question from the phone line, operator.
Yeah, good afternoon. This is for Dr. Shahab. Northern leaders have expressed frustration that a nurse from the south, from Saskatoon, traveled to Stony Rapids and was immediately working with some people up there and gave the coronavirus, or was positive for the coronavirus. What measures are going to be put in place to ensure that traveling healthcare professionals do not spread this virus to vulnerable communities?
So thank you. So I'll make some initial comments and maybe Mr. Scott Livingston to add to that. So absolutely, through measures that the SHA has already put in place and that are now being added to the public health order, I think we are trying to strive as much as possible that, especially for high-risk settings like long-term care facilities, staff work only in one facility. And where possible for other facilities, we minimize staff travel from between facilities. Having said that, there are many categories of staff who actually are specialized and will have to work at several facilities as part of their work. And for those instances, the other interventions that the SHA has put in place, like twice a day health checks, health screenings, and constant mask use, we think will further minimize the risk. Well, I'll ask Mr. Scott Livingston to add to that further.
Thanks, Dr. Shahab. And I think your answer was as complete as it could be, but I would also follow up by saying the continuous masking policy, as well as the other measures that are put in place to restrict staff per facility, will be a big addition to the other things that have already been in place to protect people. However, as Dr. Shahab has already pointed out, there still will be a need for some folks to travel, especially to locations where it's hard to recruit or we need specific specialty in that particular area to care for patients. It's not as easy as shutting the doors on a community, because we need to make sure that we're caring for that community beyond their needs for COVID-19.
I have a quick follow-up to that.
Yeah,
Is there any consideration to testing the healthcare professional before they leave that community to travel north, so that there's no risk at all of spread from that person.
Well, I'll start with the answer, and then Dr. Shahab can follow up. But there is no guarantee with swabbing and testing somebody that they're not going to have the disease, and it's because of the incubation period for the disease. So by doing that, it would be testing somebody who is asymptomatic. And right now, in our province and in other provinces, that's not how testing is being done. It's being done on symptomatic folks to ensure that we're actually testing the right people with aggressive contact tracing. We will be testing and expanding our testing options in the province, and we are considering what it looks like to expand into asymptomatic populations, but we're not there yet, and I would follow up with Dr. Shahab.
Yes, that's absolutely correct, Scott. And just to emphasize, if I'm a healthcare worker and I'm working in a facility, if I test negative in the morning, that doesn't mean I'm positive in the evening or positive the next day. And it's not practical to test everyone every day or twice a day. But what we do have is two very important interventions. One is the twice-a-day health screen and temperature check where available. The other is obviously at the first sign of any symptom, you isolate. And then the additional precaution of mask use while providing close care within 2 meters is an additional precaution that if a staff member is mildly symptomatic or just beginning to become symptomatic before they even realize it, that constant mask use protects residents from staff and staff from residents. Thank you.
Thanks very much, everybody. That's all the time that we have for today.